Good afternoon, everyone. I think it's almost, or it is at 2 o'clock. I see we've got quite a few people with us already. Just want to start with some housekeeping. Of course, this is our information session from the central office. Wanted to let everybody know that this is being recorded, and we are going to compress it into a file and send it out later so you can share with others in the district. In addition, as we're going to start here shortly. If you will, please go ahead and put in your name, your email, really your name and your district of where you're representing in the chat. We'd like to be sure that we see everybody who's here, and so we understand how far our reach was across the Commonwealth between Wednesday and Friday. So again, just as a reminder, this is being recorded and we will send it out, as well as put it on the website for a link later. And then if you'll put in your name and your district, we'd love to hear from you. And definitely want to hear more from you later as we go through the presentation. We're going to stop it a couple times because this is an open forum. We want to hear your questions and be able to talk about the testing landscape and what would be most helpful for you all. So again, good afternoon. My name is Susie Trotter, and I may be familiar to you or not. I've been around for about a year and a half with this testing project and the pandemic response. I co-lead with my partner, Jill Grumbine, as the program has diversified and the landscape has grown significantly since it first began. So today we're going to go over a little bit about, again, the testing landscape, what is available, what we have through the central office and our grants, what we're able to provide support for, and then again, have opportunity for you all to chime in. This is a repeat from Wednesday, so certainly you're welcome to stay on if you were here on Wednesday before, because there's some new dialogue to be had with some new folks. So glad you're all here. And if we can go to the next slide, I'll do a little introduction of all. So again, this is what the central office testing unit has to review with you all today. And they are the CDC Grant programs through the ELC funding. The large one is through the expansion grant, the EDX, and we have community and facility testing, which you're, I'm sure, greatly familiar with, outbreak testing capacity, and then our public health safety net for vulnerable populations, as well as our newer program, access to testing through the libraries. In addition, we have two grants coming on board through the detection and mitigation grants, confinement and homelessness, and then the rather large ELC K-12 reopening schools grant. And we'll round out with a little bit of testing resources, and then, like we say, open it up to the floor so we can hear from you today. So next slide, not to be memorized, but again, these will come out. Just as a reminder, I'm Susie Trotter, working collaboratively with Jill Grumbine as we oversee all of these grants. And basically, we kind of have two major branches outside of the K through 12 program. Carrie Hauser is our vulnerable populations testing administrator, and you may remember her or have worked with her. She was initially our LHD liaison when we had the Buy Next Now card program. And then we have Carolyn Lemire. She oversees community testing and facility testing. She's the administrator for that program. And with us today are our two central office testing coordinators, Sydney Emery and Jaleesa Turner, as well as some of our K through 12 testing coordinators, Jerry Adler, Armand Devani, and Dominique Jones. And in addition, we do have administrative support through Daniel Fitzpatrick and Kevin Beasley. So all told, it's still a very robust program, albeit diverse and different than what we started out a year and a half ago. So today's agenda is to review what resources we have. So next slide. And just as a reminder, pop your name in the chat if you haven't yet and what district you represent. So before we get down to the nitty-gritty of what programs we do have, just an overall note and a reminder about the federal resources. Initially, testing across the nation was supported and set up through Health and Human Services. The federally supplied test kits were sent directly to the states. That is no longer happening. the national or the federal resources are being directly shipped to agency partners. So the state, the central office, VDH, no longer receives those federal supplies, which you may remember as the Binax Now cards. We are aware that test kits are being shipped directly to federally qualified healthcare centers, our rural hospitals and health clinics, and food banks. It is a diversified test landscape, so it's not the Binax Now cards, but it is another at-home antigen type kit that they will be sending directly. So again, we do not get them at the state level anymore. We're not part of that logistics plan. We also understand that the federal government supports the Department of Corrections and long-term care with testing resources. We're trying to figure out a little bit more of what those are and be sure that the gap is met. So what we do have then at the state, Virginia Department of Health does have federal grants. And these grants allow us the opportunity to acquire testing resources, again, to support our vulnerable populations, congregate care, jails, shelters, and other at-risk populations. And just to note, additionally, the state Virginia Department of Health does not have a funding resource for employee testing, which I'm sure you're all aware of that, but just worth noting. Next slide, I think I am going to turn it over to our testing team to then break it down a little bit more for you. I'm glad you all are here today.
Thanks, Susie. Yeah, so we're going to get into a couple of the different avenues of testing that we do offer, most of which you're probably familiar with, but we're going to get into Vista, or the K-12 program, the Walgreens partnership with VDH, our community testing events that we offer, outbreak testing or points prevalence surveys that we're able to support, the at-home or point of care tests that we distribute, and the STACK library partnership program that VDH has with the public library system. And then I'll turn it over to Carrie. She'll get into a little bit about the ELC grants and the vulnerable populations.
Hi, good afternoon, everyone. I'm Carrie Hauser. I just wanted, as Susie alluded to a couple slides ago, we do have a few grants that are going to be, that do support some specific populations. So I'll just kind of review them here. We have the Confinement Facilities Grant, and this is going to involve providing test kits for various confinement facilities. And these facilities, as defined through the grant, are alcohol and drug rehabilitation centers, community treatment centers, correctional centers, state prisons, as well as regional, local jails, and juvenile confinement centers. So we have funding for that for those groups, as well as a homelessness grant where we are going to be collaborating with the Virginia Department of Housing and Community Development to assess and support the testing needs of homeless services providers across the Commonwealth. And there's 27 continuum of care coordination groups that we're going to be collaborating with through the VDHCD. And finally, we have our vulnerable populations funding to provide test kits and support for the most vulnerable populations in our community, specifically those with low income, people of color, uninsured, underinsured, and those with disabilities or access and functional needs or limited access to care, such as rural residents, those with transportation constraints, as well as the unvaccinated. And this program at the bottom here is probably where most of you have heard from me from. So we'll continue to talk about that a little more. Thank you.
So the first grant that I'm going to get into is the CDC Grant with Vista, which is a Virginia School Screening Testing for Assurance program. It provides testing vendors, supplies, and staffing support for COVID testings in schools throughout the Commonwealth. And our biggest aim is to keep kids in school to maximize full in-person instructions. We also don't want to bear burden to the school system, so they're able to hire staff that's necessary for carrying out the testing, to collaborate with our vendors, as well as order any supplies or technologies that are needed to continue the program. We do have about 88 public school divisions that are currently committed to Vista, as well as 24 private school programs. And then our next CDC grant is our partnership with Walgreens. We have about 67 different Walgreens across the state of Virginia that offer free antigen testing And on the VDH website, we have a testing locator that you can find which Walgreens does participate with the antigen testing. And at the end of the slideshow, we'll have kind of a list of all the links so that you can directly access those. And I will turn it over to Sydney now.
Hi, good afternoon, guys. So I'm going to talk a little bit about community testing events and outbreak testing. Just to start, as a reminder, there is no age limit for testing during these events. We are suggesting that we get testing done before and after traveling for the holidays, gathering in groups also for the holidays, and symptomatic or exposed individuals. So we do offer a lot of community testing events throughout the state. Please feel free to put in a red cap if you're interested in holding one of those, and if you need assistance with a specific vendor supported event. With that being said, we do have various levels of assistance for these events, from simply specimen collection, where the LHD would go ahead and set up everything for the event and then take down everything after the event, and you would simply just need specimen collectors to come in and swab individuals. We also have what's called a vendor supported event, which they come in and do pretty much everything start to finish. There still is some assistance needed with certain paperwork or different things like that. So make sure that you're available for assistance if needed. We also have whole genome sequencing available upon request. So that is something that we do honor at I think most of the labs throughout the state. And then as far as CTEs and outbreak testing and red cap, they pretty much go hand in hand in our COVID world. As you guys know, putting in a red cap doesn't take too long. We do have a new protocol that we are asking for 4 business days ahead of any event that you are putting in. This just ensures that we have enough preparation and the proper amount of time to make sure that it's advertised on the state site, and that our vendor is able to staff appropriately and prepare. Once the vendor is chosen by our team, we will ensure that kits and supplies are delivered if needed, a lab is secured, and that the event date is prepared and ready for you guys when the event happens. And as far as, submitting a red cap for something as simple as lab space, please make sure that you guys go ahead and put that in. Jaleesa and I handle that. We can get it done quickly, but it also just really make sure that we're aware of what events are going on, so that we can properly advertise and make sure that everybody that is able to look at the site and that is looking for testing has the information available.
Okay, and just to get into a little bit more of what Sydney was saying, there's kind of 3 components. There's things that are always handled by us at the central office, which includes getting the test kits and making sure they're shipped out to you guys, securing the lab space with whichever vendor is best for your event, making sure the event gets on the VDH website. We do have a link as well where you can modify, cancel, or edit or request that to be done if your event has been canceled. So it'll happen a little bit faster than emailing us. Selecting the appropriate vendor for the event is really just based on the availability of the event of the vendor, scheduling, and how large the event is. And then there's things that we can handle or the LHD can handle, but it does need to be requested. And I think a lot of this gets confused a bit. Bringing the test kits to the event is something we can make sure that happens. Or the LHD can do. Supplies, we did add a new question into the red cap to really specify that the more information we have, the smoother we can make this event go. We can make sure forms, documents, labels, all that are printed. We just need to know if that assistance is needed. And then specimens can be couriered either back to the LHD by our courier or someone at the event, or we can schedule a special courier pickup as well. Results are something that we are in the works of making sure that we can offer to every event, because I know that that's a huge thing for the LHDs to do. but that just needs to be specifically requested. And then certain things that the LHD is always going to handle, as Sydney said, filling out the REDCap survey, securing the event location, you know your community's best, you know where best to hold these events. The dates, hours really just depends on the facility or the location. And then just really being in constant communication with us so that we can make sure that these events go as smoothly and seamlessly as possible. And I will turn it back over to Carrie to talk about the at-home and POC tests.
Thanks, Jaleesa. So many of you may be familiar with these test names at this point, but I wanted to review what kind of resources we have for the at-home point of care tests. And just a reminder, all of these tests are considered over the counter where you don't need a provider order, with the exception of the eMed, which I'll explain in a second. And they are also CLIA waived. So if you do have a CLIA certificate, you can operate under those guidelines and those protocols and use them on site. So we have the BinaxNOW antigen card home test. And this particular BinaxNOW is a virtually guided single antigen test. So it is like a telehealth appointment. There's a proctor available online through eMed. This is the company that proctors, and eMed provides both the ordering provider, the order for the test, as well as the CLIA waiver. So that takes care of everything. But those who are taking the test will need internet access, as well as a device that has a forward-facing camera and a microphone, because they'll need to interact with the proctor. And the proctor or guide will walk them through the whole test from beginning to end, observing them performing the test, as well as helping interpret the results and then report the results to public health. So there is a bit of a registration just in the beginning to sign up for an account prior to starting the session. And so those are some of the details of the eMed proctored BinaxNOW home test. We also have the Quidel QuickView at home, which is a serial test. It has 2 antigen tests within one box. And so this is something, in addition to the eMed, these are easily handed out to your to the individuals so they can take them home or perform the test wherever they want. The Illum COVID-19 home test is another test we have available. We're going to be receiving from the federal government. We have not yet received these yet, but we are hoping to soon. We just don't have a timeline. So it is an option. It's just not currently in stock. We also have the Q COVID-19 test, which many of you have probably used. It involves an analyzer, and then there's individual test cartridges. And we found that this is actually really helpful in a clinical setting, but it's very helpful to have more than one analyzer because each test takes 20 to 30 minutes to complete. And so if you're trying to run multiple tests, it's really helpful to have more than one analyzer. And we also offer the Lucira Check It COVID-19 test, which is a molecular test. These last 2 tests, the Q and Lucira, are both molecular. So they're PCR-like. They're not PCR per se, but they are PCR-like, and they are molecular tests. So there's a link here. We are going to be sharing the slides after this call. And the link here brings you to our at-home testing page. We have a table of all of the emergency use authorized tests, so all the FDA approved at-home COVID-19 tests, so you can review those. But this list is what we are currently offering as supply allows. So I should have put that caveat at the beginning. Many of you have reached out to me and have heard that we are doing our best trying to get all of these supplies. And this is ideally, we'd love to have a full stock of all of these tests. We are at the mercy of the manufacturers and also just, how quickly we can get them delivered to us. So if you put in a request for any of these tests, please know that we're receiving them and we try to fulfill them as soon as we have supply. And if you ever have any questions, you can always reach out to me. But these are the kits that we are currently offering. If I could have the next slide, thank you. So we want to thank you for completing the survey that we sent out a couple of weeks ago. We had a really great response, and we thank you for taking the time to complete it, because hearing all the information from you on the front lines, it really helps us with our planning and our strategizing, and it helps us know what any tweaks we need to make and what else we can do to meet the needs of our local health districts. So this slide really is summarizing the question of, which at-home tests have you ordered, which ones have you used, which have you not used? And we wanted to take a pause here to maybe have some dialogue either over the chat or you're welcome to unmute and ask a question. But this is just showing us, it looks like, for EMED, for instance, many have not ordered and not used, but Lucira seems to be one that has been ordered more and frequently used. We just wanted to kind of understand a little bit more about how these tests are being used, and if you have any feedback or questions about them, and we'd love to hear. So if you want to start some chat dialogue, we can do that, or feel free to unmute and ask a question. And I see, looks like Heather has asked, how would you recommend entering these at-home molecular tests into VEDS? Which test lab type? That is a good question, Heather, and maybe somebody else might be able to speak to. I've actually never entered anything into VEDS that way. I know that many of the, it is a molecular test, so I don't know what the options are in terms of when you say what test lab type, and you're welcome to unmute and to clarify the question.
This is Susie, unless Heather wants to pop on. It is a gap. It is an understood gap that not all of these tests will be entered into our system. I think as a nation, and CDC and public health is grappling with this identified gap. We're kind of looking at the numbers as a whole. It does affect, containment and follow-up, but it is an identified gap. That part of the funding at the federal level is working with manufacturers so that they build their platforms so that they will have some kind of app that automatically upload to public health. So not really the burden at the local health department level to do it, but know that there are work groups working on that.
And Heather, thank you, Susie. And Heather, as a follow-up with these at-home tests, they are CLIA waived, and if they're being performed on site at your health district, they can be added into their results can be added into the point of care portal, just as we were doing before for the Binex Now antigen tests. So they can be entered that way, but with the understanding that not every at-home test result is going to be captured. We do encourage those using the at-home test when they're being, handed out in communities to follow up with their healthcare provider, especially if they have a positive result. So, and in hopes that it will get reported that way. But yeah, there's definitely, this is not a perfect science with reporting with these at-home tests, but we are getting additional tests out there so people at least know their COVID-19 status. Lisa, I hear you with the Lucira. I know, I think a lot of people have experience using Lucira and have liked it. We get very limited supply. So when we do get it, we try to allocate and send what we can. We may not be able to fulfill entire requests, but we do hear you. We're trying to get more. We try to get as many as we can. We are on monthly shipments, and they kind of come a little predictably. So we are hoping to get another shipment early next week, and we'll get some allotments out. And thanks for offering your Q test. Oh,
This is Susie. I'll say, it is a mixed review about the Q. It's kind of like it either works or it doesn't. But I do believe we can get other analyzers, right? I think Heather was asking.
I'm sorry, I'm still scrolling through the chat. Yes, thanks for keeping up with Yes, so we have more analyzers that should be arriving as well next week. And so we can get more out to you. I know several of you have requests for additional analyzers. So we're looking to fulfill those as soon as we get the inventory. And I know that
Kira has a good question about homeless shelters, and this is perfect timing because we just spoke with the continuum of care folks yesterday and kind of devising that plan. You want to share, Carrie, the process to get them test kits now?
Sure. Let me just look at, I'm sorry, I'm like, can't keep up with this chat. You guys are doing great. So for the homeless, our homeless shelters, we do have through this same request process that you've been doing, we can send directly to homeless services providers, including shelters, and those providing, medical care to those who are homeless. So those can be ordered, and Kira, I'm happy to help you with that or reach out to a provider. It's not RedCap, it's actually a Google form, just to clarify, and I'll drop that link in the chat in just a moment. But yeah, we can certainly get tests to homeless services providers. And we've been receiving a lot of requests through those providers. So that's great. Okay, and were there any other, I know I've seen some other things about, let's see, there was a little bit more about the queue. And so we understand, as Susie said, it's some people really love it. Some people have had some issues. I'm happy to talk through and get you connected with someone at queue if you have some concerns. But
yeah, I think we're most up to date, but we'll have more opportunity for questions.
Absolutely.
After the next speaker.
Yeah, and we'll be monitoring the chat too. But thank you for taking that pause with us. Appreciate it. Thanks.
So I just want to brief you guys a little bit on our new program called STACK, which is supporting testing access through community collaboration. And this program has absolutely exploded in the last month or so. It started in November. And basically we're handing out free test kits for anyone ages 4 and up at local libraries. Any local library can sign up. Like Carrie said before, we will be sending out the slides, and at the bottom there is a highlighted word survey. Feel free to click on that, have them fill out the information. We send out weekly to bi-weekly, I believe, test kits, shipments. So and these are the Buy Next Now antigen card home tests. They do require a valid photo ID. They also require internet access and a smart device that has a camera as well as audio. So that is something that may not necessarily work for every single district, but the majority of the libraries that have already started participating have really liked it and really have gotten good feedback. So this is something that, like I said, over 40 libraries now are participating in the program. We're still taking people or still taking different libraries for the pilot program. So if you are interested, please fill out the survey and we would be more than happy to add you guys to the list.
Okay, and this is just kind of a flow chart of how the STACK program works, just kind of each component. VDH gets the kits. As Sydney mentioned, they are EMID proctored Buy Next Now kits. And we also have a web page and phone number. There is a label, as you can see at the bottom right. This label is affixed to each box. We direct all of the people getting, or the community getting the test kits, not to ask librarians and bombard them with questions. We direct them to VDH, either the phone number, the website, or their local health district. Libraries can choose to opt into the program. They're able to order kits weekly, I believe, in increments of 75 based on demand. They also develop their distribution plans. Some libraries have certain hours that they distribute kits. Some distribute them the entirety of the time that they're open. A lot offer curbside pickup to have kind of contactless distribution of the kits. They also are responsible for monitoring their inventory, and they report to us each week how many kits they have distributed. The community, it's very easy. They're able to go and pick up the kits. They do have to have a Navica account. on their smart phone or device to take the test. And then EMED automatically reports those results to VDH. And it does say that the pilot will run until December 2021. We are looking into taking it into the new year. And then this is just kind of some preliminary stack results. These are actually the number of kits that have been distributed to community members, not the number of kits that are ordered. There's an increase in tests delivered, in some cases due to the increased demand of the kits as word kind of grows of how the program is existing in these communities. And then we are also adding libraries each week, so that we expect that number to continue to increase. And the libraries are in constant communication with us. We are in the process of sending out a survey to them to just kind of get feedback, see what we can do better, see what works based on each community and district.
And to follow up the STACK program, we also have our VDH testing locator page. These events are only events that have had clarification on REDCap that they would like to be presented on our site. So we do need an affirmation on REDCap to post your event. And this shows every different kind of testing that we have, including the Walgreens that Jaleesa spoke about earlier. If you scroll down past the map, you can get a daily to monthly schedule of, specified in each district of different testing events that are available. And it also lets you know what kind of event it is, whether it's PCR testing or rapid, but not all of these events are free. So the constituent that does want to go and get tested and that does look on this testing locator page, we urge them to call and clarify the ask if it's not a general CTE.
And then these are just the helpful links that have been scattered throughout the presentation. When Susie distributes this, everybody will have access to it, so you can kind of have links all in one place. And we will wrap this up and I'll take it back to Susie.
Great, thank you, Jaleesa and team. And so this is our opportunity to hear from you, or if you have any questions based on what we presented today. I see there's still a couple of questions in the chat that we'll be glad to address. Again, thank you for taking the survey. That was our basis for bringing this information forward to you all. Again, thank you for your patience with the changing landscape of testing. I know each district and area, some of y'all have been voluntold to be testing coordinators. Some were able to hire PHN testing navigators. So we know it's a good variety out there, including the local emergency coordinators. So we appreciate whomever you are that are standing up and being the resource for testing at the district. Really appreciate your support and input. We did ask on Wednesday a little bit from everybody, how would you like to receive information? We do give updates on the Friday health department calls, Friday morning calls, but those are very robust sessions with a lot of information. So we appreciate the opportunity to just talk about testing every once in a while. So let us know if you'd like any more info sessions. We were thinking maybe quarterly, and as things change throughout the pandemic, we'd like to get you up to speed. Just curious if you work with the regional containment teams at all. I think we need to go hand in hand, with the testing. And then how else we can support. I see, Michelle, you put in the question, are we developing a tool for local health departments to track home test kit distribution? And I'm going to lean in on Carrie on that, but no, this is where, it's wonderful to work with the localities, because you all know who your population is. You all know where you need it best. There's no way we could design it at the state level. So we believe you'll prioritize, on who you would send to. Carrie, anything else on that as far as tracking home test kit distribution?
Yeah, thanks, Susie. And Michelle, thanks for the question. You know, as we, when we started out with these at-home tests, just trying to figure out, you know, how to handle it, we just felt it may be a little too wieldy to try to track every single at-home test that was going out there. It would be really nice to know where they're going. I just think it's a very hard thing to track, and just another thing for you all to have to do at the local level. And I think as a team, we discussed it and thinking we want to get the test out there. And even if we don't have every single bit of data, I know we like data in public health and our team likes data too, but we kind of had to come to a compromise to say, all right, we want to get these test kits out there. We know what you at the local health district and the free clinic, we know what people are ordering. And we've kind of been using that to understand what's going out there, how frequently they're being used, and trying to extrapolate from there. So we don't really have a specific way to track at that level of detail where these tests are going, but just hoping when they're distributed, they're going out there and people are using them when they need to.
Yeah. Thank you, Carrie. And Michelle, another great question too. Thoughts about using this library testing model in other venues? Absolutely. You know, we tiptoed into the water. We did model the program after Ohio, who had a very successful program. But yes, museums as well are interested in doing it. We have reached out to DMV before. We'll probably circle back once we analyze how it went during the pilot, which so far has been quite robust. The whole goal, like Carrie said, is to meet the folks where they are, get the resources, get the testing available so that we can make a dent in the pandemic. So yeah, good suggestion. Oh, you're too sweet, Heather. You're not a bother. Sydney and Jaleesa, is there any way to learn that our CTE has been confirmed without bothering you all? It's no bother, no bother.
Yeah, Heather, you're not a bother. I will go ahead and for Jaleesa and I just apologize. We have been a bit busy. So if we do it does fall through the cracks and you haven't heard from us and it's been about, several days since you've submitted, please send us a text, send us an email, give us a call and just ask. We have no problem and you are not bothering us. We just have 1,000,001 things on our plate as far as events go. And sometimes if you don't hear from us, it's good. And if you do hear from us, it's usually a problem. So we suggest if you don't hear from us, just reach out. We'll get back to you as soon as we can. And I do know that we are working with a new provider and a new vendor called Maxim. So there will be a little bit of a bumpy road in December, and we're trying to figure the ins and outs of this new vendor as they are a little different. So I appreciate the patience coming from a lot of the different districts. Some of you guys are on here. Don't hesitate to reach out with questions. Jaleesa and I will do the best that we can to answer them, being that it is a little different. But yeah, once again, Heather, just send us a text. I mean, you're pretty good about it anyways. We keep in contact pretty often. So it's never a bother to answer those kinds of questions.
Thanks, Sydney. And I see a question from Kira to order another Q analyzer. And I know, Carrie, you're going to drop in the Google form as far as ordering. The second part of that, can you provide these to clinicians who need to perform office-based pre-procedure testing? Our ELC Cdc grants does not cover private practice. So that's a little stretch on the utilization. We could connect them if this is private practice, we could connect them to the Q vendor. I don't know, Carrie, if that's something we could follow up on specifically with Kira to know a little bit more about the request.
Could I simply have a vendor email you directly? A lot of our clinicians here in Harrisonburg, like at gynecology and dermatology offices in particular, where they do short, quick in-house procedures, they're having trouble getting access to rapid tests themselves. And they like to be able to test someone before they do a small procedure like that. Could I just have them email you directly? It's only like 3 or 4.
Sure. We can connect them to the vendor. That would work.
Okay.
Yeah.
Awesome, thank you.
Sure thing.
Yeah, and more, there's some good resources out there helping connect people with how to get tests, whether it's a provider's office and they're doing it on a larger scale or just individuals. And we can drop some of those links in the chat too. I did put the request form for the local health departments, free clinics, federally qualified health centers, and homeless services providers. But any private practices, as Susie said, we're not really able to support at this time with tests, but we can certainly try to get them connected. So thanks.
And it looks like Dylan wants to know how to redistribute the Q analyzers. Maybe we can follow up.
Yes, Dylan, and I know I've been in touch with Tracy, with all of you as well. We can talk one-on-one and try to get that taken care of. I know some people have analyzers that they're no longer using, and we'd love to be able to redistribute them. And so, please feel free to contact me or testing info, and we'll try to get them redistributed. But we appreciate you being good stewards of these resources. So thank you for that.
Yeah, and hot off the press, we did just talk earlier today as a team with our EMS, fire, first responders. Karen Owens, who oversees that function, and with the 11 regional councils. So we're working on a plan with them to figure out the gap. Again, the Binax Now cards have dried up as a resource from the federal drop that was there. Most of what we understood from today's call, most of the fire EMS do have resources to do their testing. We're just looking at a gap through March. So I know several local health districts have been supporting and giving fire and EMS some of their testing supplies. Really appreciate you all staying connected in your communities. And you can expect soon, once we narrow this down, they're collecting some data for us, but we're looking at doing a direct ship to the councils through March to get them through flu season, and then they'll be on their own to purchase their own kits. So just want to give you that heads up that we're working on that process right now, and we'll definitely inform you when we wave the green flag and that they will no longer need to request through the local health department for testing supplies. We also have another call set up with long-term care facilities because, again, the Binax Now cards are just a different situation. We don't have the backup at the health department like we did before. And we do know long-term care is running into experiences with manufacturing and supply chain challenges. So we're going to get a little more information on that this afternoon and be sure we can address the gap as best as we can. Again, we have no magic to get any more resources than anybody else, but we do have a little bit of power with the state contracting and our vendors. So we're looking at fulfilling that gap for their testing needs too. But appreciate the local health departments reaching out, staying connected in the community, and cluing us in when there's needs. And hopefully manufacturing, we do understand by March, it should be quadrupled, and resources should be more readily available. So appreciate your patience during this finessing of what's available, when we can get it, and who we can get it to during these crazy few months. And Carrie put in a resource. Thank you, Carrie, for the Connect to Test for other organizations that want to look for testing. I'm not sure I see the Google form. There it is. Carrie, thank you. So at 2:35, Carrie entered in the at-home POC test kit Google form for you all to request from the state office, any of the at-home point of care, Q, etc. Any other questions? That anybody, anything's good. Again, thank you for your time. I know this morning I sent out the PDF slide deck, a copy of that. We did record this as well. So anyone that supports testing, even if they're not directly involved in testing at the local health department, but you want to get this information to them, we'll be glad to repeat. I'll send it again so you have access to it. Thanks, Kira. You all have an excellent holiday. I hope you get some rest. Thank you for your perseverance. Appreciate working alongside you in this pandemic. Have a great day.